Good morning, ladies and gentlemen. Our research team here at Monash University would like to welcome you all to this presentation, where we propose a new drug formulation to treat osteoarthritis. The proposed formulation is an intra-articular injection of celecoxib, where the drug has been optimized for slow release from a polymeric gel. Targeted delivery of celecoxib to the knee joint reduces the dosage needed, systemic exposure of the drug, and cardiovascular side effects. Another advantage is that patients will only require one injection a month rather than taking 1 or 2 capsules daily. In that perspective, we will highlight the relevant topics in order to achieve our desired formulation, including the chemistry of the molecule celecoxib, stability of the drug and current formulations, the excipients used along with the manufacturing process, the bioequivalence of our proposed formulation. First, I would like to refresh your memory about the chemistry of the molecule celecoxib. Celecoxib is a non-steroidal anti-inflammatory drug with a diol substituted pyrazole structure. It is a BCS class 2 drug that is highly lipophilic, poorly water-soluble, with oral bioavailability of around 40%. Celecoxib is a weakly acidic with pKa of 11.1 and has very low water solubility of 3.3 milligrams per ml, which contributes to high variability in absorption after oral administration. When given under fasting conditions, peak plasma concentration of 705 nanograms per ml are reached after approximately 2 to 3 hours. It is extensively metabolized by the liver by CYP2C9 enzymes. The mechanism of action of celecoxib involves the inhibition of prostaglandin synthesis, primarily by inhibition of COX-2. COX-2 is induced in response to inflammatory stimuli. This leads to the synthesis and accumulation of inflammatory prostanoids, causing inflammation, edema, and pain. It is commonly used in the treatment of osteoarthritis, rheumatoid arthritis, acute pain, painful menstruation, and menstrual symptoms. It is marketed by Pfizer under the drug name Celebrex in capsule form.
Celecoxib is a highly lipophilic molecule and has a low aqueous solubility, but still exhibits moderate oral bioavailability. This is due to the high concentration of celecoxib in the small intestine, leading to passive diffusion across the gastrointestinal wall. However, for this to occur, it needs to be able to dissolve into the aqueous environment in the gastrointestinal tract. Currently, on the Australian market, celecoxib is marketed as either 100 mg or 200 mg capsules under the trade name Celebrex and other generic alternatives. The capsules are formulated as a dry crystalline powder encapsulated in a gelatin outer layer. Coming back to the problem of oral absorption, Celebrex has an aqueous solubility of 3.3 mg per ml. The small intestine has a large volume of water and thus allow for enough drug to be absorbed. This is further assisted by using a dry powder form as it decreases the rate of dissolution, resulting from higher surface area that allows for more contact with the gastrointestinal water secretion. One issue is related to the use of gelatin as the main component of the capsule, as it has temperature instability. Lower temperature below 15 degrees Celsius freezes the gelatin, making them very brittle and potentially expose the dry powder to the external environment. High temperatures above 30 degrees Celsius facilitates the melting of the gelatin, resulting in the release of the drug powder or hindering dissolution from the decreased surface area. Another issue is related to the cardiovascular risk of celecoxib. Being a selective COX-2 inhibitor, it helps with reducing inflammation. However, it also reduces the production of prostacyclins, compounds with antiplatelet effects. Prostacyclins opposes the action of thromboxane A2, which increases platelet aggregation. Celecoxib disrupts the harmony between prostacyclins and thromboxane A2, resulting in an increased risk of thrombosis and escalates the risk of stroke, myocardial infarction, and deep vein thrombosis. With the related issues from using celecoxib capsules, our team proposes a new design that will avoid these issues, particularly the associated cardiovascular risks.
Our research team here at Monash University has developed an injectable formulation of celecoxib to reduce the cardiovascular side effects of oral administration. Other advantages of our formulation are that it is slow release, allowing once a month dosing. Also, as delivery is directly targeted to joints by injection, a lower dosage is required to be bioequivalent with capsules. The formulation consists of celecoxib in a thermogel. Thermogels are liquid at room temperature and form gels at 37 degrees following injection. They consist of synthetic polymers which are degraded by hydrolysis in the body. Sustained release of celecoxib from the gel is mediated by a combination of hydrolysis of the polymer and diffusion of the drug. Gel agent is a polymer of ethylene glycol, flanked on both sides by a polymer of caprolactone colactide. The polymer has properties similar to a surfactant, as the PEG is hydrophilic and interacts with water, while the PCLA is hydrophobic and interacts with celecoxib. This particular polymer was chosen because it has a slower rate of hydrolysis compared to other polymers and releases therapeutic levels of the drug for 1 month. Several formulations of this polymer were optimized for thermosensitive gelling and for extended release of celecoxib into the synovial fluid following intra-articular injection. The steps in formulation are mix polymer and celecoxib in phosphate buffer, autoclave, vortex, and store at 4 degrees. We would like your pharmaceutical company to consider developing our product for the market. Like all formulations, we recognize that there are stability concerns with celecoxib in our slow-release gel product. Physical instability appears to be more of a problem than chemical degradation. Precipitation of celecoxib, or formation of crystals over time, is a major issue because injection of crystals may cause more cartilage damage. Studies of the chemical stability of celecoxib in suspension showed no significant degradation caused by mild acid or alkali, heat, hydrolysis, or photolysis. However, some oxidation occurred.
I'd like to talk about excipients in the formulation. Acetyl-capped PCLA, PEG, PCLA is a biocompatible and biodegradable copolymer which completely encapsulates celecoxib, enhances drug solubility, and prolongs drug release in a sustained and controlled manner. PEG is a hydrophilic polymer that improves celecoxib solubility and the rate of degradation. PCLA is a hydrophobic copolymer that prolongs drug release in a controlled release rate. PCl is a hydrophobic polymer that is used to increase drug release time. PLA is a hydrophobic polymer that is used to reduce drug release time. Acetic anhydride is a type of acid anhydride that modifies copolymer rheological properties and increases drug release time. PBS pH 7.4 is a pH buffer solution that stabilizes celecoxib and copolymers. The celecoxib-loaded hydrogels are easily injected into joints and produce in situ depot gels which contact with the aqueous synovial fluid. Then celecoxib is diffused via the synovium into the blood capillary and transferred into the body by the lymphatic system. Structure of celecoxib-loaded gel are: mix celecoxib and copolymers in ethyl acetate, filter the solutions with 0.2 mm PTFE, transfer to sterile dishes, and flow for 48 hours under nitrogen. We propose to package the product in single-use sterile glass vials for injection.
As we previously mentioned, CelexGel will be formulated as an intra-articular injection. This type of injection involves introducing the drug directly into the synovial space. This diagram represents a typical synovial joint with the two bones and the synovial space in between filled with synovial fluid. The needle must penetrate the capsule and synovial membrane to the synovial fluid here. Once inside the joint, CelexGel becomes a gel which prolongs the release of celecoxib into the synovial fluid. This gel is the critical component of our formulation, as it holds the celecoxib in the inflamed joint where it is needed most and minimizes its plasma concentration. It also prevents the synovial fluid from washing the drug out of the joint as it drains into the lymph system. CelexGel is better than oral formulations of celecoxib for three main reasons. 1. The dose of celecoxib in CelexGel is lower than in oral formulations. By injecting straight into the joint, none of the dose is lost to hepatic first pass metabolism. This is better for the patient as it decreases potential side effects such as gastric ulceration and thromboembolism. 2. The injection targets the therapy to the inflamed joint that needs it most, maximizing its anti-inflammatory effects, and maintains concentration within the joint. And 3. The sustained release gel allows less frequent dosing for the patient, which is much more convenient for them.